People have a spectrum of pain, so it's not easy to predict necessarily, but I mean, I guess I was just fortunate that I lengthened 15.3 centimeters and I didn't get any nerve pain. I mean,
like I said before, it's not only about the nutrition or going to the gym, but also try to not stress too much, because nowadays we stress a lot. It's not healthy for anyone, especially for diabetic people.
Guys, I'm with my patient. His name is Michael. He did with quadrilateral Precice 50.3 and he reached 186.3 centimeter. How do you feel?
Feel pretty good. Just had the picnic, so obviously some stuff to eat, drink, right? In the sun, that's the idea.
We finished the lengthening. After that, he changed the nail for extra stability, for extra bone healing. After that, the recovery process will start, and he started to walk with crutches maybe 2 weeks ago. He started to walk also without any support, but he needs to be used crutches for safety.
If I don't use crutches right now, I walk like a penguin. That's the idea.
Yes, why? Because during lengthening, he's losing the power. I mean, especially hip muscles power. If he don't have strong hip muscles, he lost the stability and he walk like penguin. That's why all patients walking like that after especially remove the fixator and finish the lengthening. When we started doing exercise, it's getting better, but he's good right now.
Yeah, I mean, right now the rehabilitation process is pretty boring because I'm not actively lengthening anymore. I was saying this in the last clip that, I had more patience actually when I was lengthening, because day to day you got to put in a lot of work, but between the pain and just, really keeping things together mentally, and there was tangible gain every day during the lengthening phase, but now it's just the rehabilitation phase. You feel a degree of impatience to just accelerate things and, get back to normal life. That's how I feel right now. So every day is sort of, I just got to work on core. So I do abs, I do hip abduction routine, the bike, I do the physiotherapy, work on walking. So it's just repetitive day by day stuff that has to get done. And then eventually.
Are you feeling it's going well?
I feel it's going fine. As I said, I just feel like I really want to accelerate and move on already. So the notion of well would mean I have like a major breakthrough in my walking, where let's say next week I'm like, wow, I don't walk like a penguin and I can walk long distance, and that would be well.
Do you have any pain when you walk right now?
Yeah, I mean, I sort of have like pain always. It's just like a dull bone pain, muscle pain. Every patient has different levels of pain. Some patients say they have no pain. I mean, some patients have nerve pain. So, I mean, I'd say mine's kind of in the middle. Their level of pain is somewhat untethered to even their degree of lengthening. I mean, you're obviously gonna have a positive correlation that the more you lengthen, the greater propensity to have more pain, such as nerve pain. But there are patients who are younger, older, patients who lengthen more conservatively versus more boldly, and people have a spectrum of pain. So it's not easy to predict necessarily, but I mean, I guess I was just fortunate that I lengthened 15.3 centimeters and I didn't get any nerve pain. I mean, the lengthening pain was significant between 12 to 15.3, that final stretch. That's why you see, and I was talking about this in the last YouTube clip, this is why you see a lot of people wimp out when they get to like 13. And I'm not just saying this like in a general sense, like you get people who watch the YouTube clips who comment and will ask, they'll say, oh, why did that patient stop at 13.2? Why did that patient stop at 12 when couldn't they have done 14 or 15? It's because the pain is difficult for people to handle.
Everybody's different.
Everybody's different. I mean, you really got to put in a lot of mental energy to get that final bit of lengthening, which I was fighting to do.
Was it manageable?
It was manageable because I wanted it enough, Like the whole month of May, so it's early July right now, 2024, but the whole month of May, I fought really hard to get that final bit of lengthening across. And there's people who do more conservative lengthening and their rehab is faster. It's, a bit easier for them, but it's like, well, who ended up taller? So that's what you got to do.
And last week you said about your scars. Yeah, if I have...
Yeah, so I don't like my scars necessarily. I mean, we don't have to like draw attention to them, but people are gonna have scars and the colors will change over time. I mean, fresh scars are gonna be more pink. And then I don't need to go into the whole medical jargon stuff right now, but scars will become white over time and less noticeable. The point Akin was bringing up was that prior to lengthening, You know, like I knew all this stuff would occur and it's still worth it. You know, it's like when you're shorter, you're willing to do anything. Like you don't care about the scars. And at this point, like I don't care. I would have double the scars. That's what you're gonna bring up.
Yeah.
Yeah, it's
Doesn't
still
matter,
it's still worth it. We're doing the picnic, right? And we're sitting, and I wanted to get up first just because I was just getting a bit antsy. Like I was still in the same position, and then that ended up spurring off this interview, so that worked out.
It's good.
You know, but it's nice to
Sun is giving the energy. Yeah?
happy about that. It was good to walk.
Yeah.
Thank
Thank you.
Today I'm with our patients at Seaside. We are like doing some exercise, walking, enjoying the sunshine. How are you? How is everything going?
Everything's good. I kind of like this activity because it brings you out.
By the way, we are in the group activity right now, and we are with another patients also. Like this is your first time, right?
Yes,
Being
first
outside
time.
of the center.
First time, yeah.
First time, okay. How do you find here?
It's nice. It's a really nice park. We're close to the ocean. This is what ocean is this?
Oh, not ocean. This is not ocean. This is just the sea. This is Marmara Sea actually.
Okay, okay. Because
And
I see it
these
from
are
the
the
hotel,
islands. These are the islands, Prince Islands. Have you heard it?
but no.
Okay, I just want to talk about a little bit about your nutrition here because you are diabetic.
Yeah.
You have diabetes and you are taking insulin, and we are
Yes.
trying to arrange the foods of the carbohydrates and everything. Can you like talk about it a little bit? How is the being here nutrition-wise?
It's been good. It's been very helpful because you have also showed me what I can eat, suggestions. I've had diabetes for 15 years now, since I was very young. So, but it's been very difficult at times because it's not only about food sometimes, it's also about emotions,
Yes,
stress, and all of that. So I've been learning throughout the years, but nutrition is also something very important.
This is a total different situation for your body also. You spend a lot of calories, your body in a catabolic rate right now and everything. Of course, your body tries to fight against the lengthening, pain, and also the diabetes, and we are trying to arrange the blood sugar regulation also. This is the one of the important point with diet. Maybe this activity also a little bit difficult for you. I don't know, maybe there are some things that you should avoid normally. Today is okay. I think you can solve it with more insulin.
Yes, yes. As long as I know how many carbohydrates, because
Yeah.
I use this insulin pump, so it's a little bit easier to manage. It's been nice going out and see the sun, get a little bit of vitamin C, D.
Yeah, vitamin D. I was going to say same thing. Vitamin D is the main source. Sun is the main source of vitamin D, and it's really important for bones also. This is the best way to get some vitamin D. It's not found in the foods, as you know, maybe.
Because I'm diabetic, encourage people that have diabetes to always try to check on what they eat. And like I said before, about and it's not only about the nutrition or going to the gym, but also try to not stress too much, because nowadays we stress a lot. It's not healthy for anyone, especially for diabetic people. And no, I'm super happy that I'm here. I'm happy that I took the decision of doing this, because at the beginning it was something that I thought about a lot, but I was a little bit afraid being diabetic. Now that I spoke with the team and they said that there was no problem. I also spoke with my doctor in California. As long as I try to keep focus, try to maintain my blood levels as close as possible, because it's never going to be perfect, but we're following up. That's the most important thing.
We had diabetic patient before, by the way, and we got good results. And I think we will complete your process also in the good way. We will see.